Dr. Taylor, Dr. Jacoby, Ms. Becerra, and Mr. Cruz, and now Mr. Conaby. So that means we have a full board, and it is past 7:30, so I call the meeting to order. I'd like to begin the meeting by reading a script that the town of Acton wishes me to read. I'll go with the abbreviated version. But basically, good evening. This is the meeting of the Board of Health. It's being conducted remotely due to the ongoing pandemic. In accordance with the state's directive from the governor. It allows meetings to be conducted remotely as long as there's opportunity for public access. And whoops, something just happened. It wasn't good. I think you just shared your desktop, Cheryl. Now I'm seeing the Grand Canyon. All right, is everyone seeing the Grand Canyon besides me?
Yeah, I was just trying to put the agenda up for, sorry, I didn't mean to cause you to stop.
Okay, that's all right. No worries.
A lot of files in the Grand Canyon.
Yeah, nice picture.
Yeah, I don't know how to share my screen other than the way I just did it. So you unfortunately have to see my whole screen till I get the document up. So
well, good thing nothing embarrassing showed up, so we're okay. Okay, so the meeting's being conducted remotely in accordance with the governor's order during the pandemic. We will offer opportunities for public participation, usually after discussion by the board of any particular agenda item. Just be aware the meeting is being recorded, and the meeting materials are available on the DocuShare on the town's website. I'll try to introduce each of the topics. If you're a speaker, please state your name prior to speaking. Please mute your microphone when you're not speaking. And if you wish to speak, please raise your hand or otherwise indicate to the moderator, which is Ms. Ball, the Director of Public Health, that you wish to speak, and we'll try to accommodate. And just finally, because of the virtual format, we tend, but it's not required, that we conduct votes by roll call. In some cases where I anticipate a unanimous vote, I may just take a voice vote. And with that, the first item on the agenda, as I see from the one in front of me, is an operational update from our director, Ms. Ball. Please.
hi, good evening, everybody. So the first thing I want to talk about tonight is the conversations I've been having with the district, the schools. So just so you know, we've been up until recently meeting weekly via Zoom with the superintendent as well as the town of Boxborough. So we've had many, and I've had many opportunities to discuss the goings on in the school plans. So I just wanted to call that to your attention. And then previously, last week, I think it was Monday or Tuesday, we actually had a Zoom meeting with myself, the superintendent, and the assistant superintendent to go over the DESE guidelines. So with that being said, we have, the state puts out new metrics on Wednesday, so that's today. So last week, which was 8/19/2020, we bumped up to shade green. So the way it goes is unshaded, green, yellow, red. So unfortunately, we bumped up to the green because we had a 1.5% average daily rate per 100,000 in the last 14 days with a 0.55% positivity rate. So that was last week. Fast forward to today, we are now, we're still in the green, but we're currently at 3.3% average daily rate per 100,000 in the last 14 days with a 1.04% positivity rate in the last 14 days. So we have increased. It's also, I just want to note that I think effective next week, I indicated that we were unshaded, green, yellow, red, and now we're going to be going to gray, green, yellow, red. I guess someone doesn't like the terminology unshaded. So like I said, that's a bit concerning to me. I have met with the schools, as I mentioned earlier, and they are preparing to offer hybrid learning. So the DESE guideline. So in the conversations that I've had with them, so the DESE guidelines have been a bit unclear, and they weren't quite consistent with the DPH guidelines. So they've made some changes just recently. I think late last week. So schools are prepared to offer this remote learning and school learning, and uh, both. So they plan on the DESE guidelines says they have to maintain 3 feet separation, but our schools are planning on maintaining the 6 feet separation. So this would be like between the desks. The testing. So let's hope this doesn't happen, but if we have to plan for possible transmission when the school reopens, the school has indicated to me, and with our conversations, that they're planning on going a bit more restrictive than the DESE guidelines, which I'm happy to hear about, and that's part of conversations that we've all had together. So, in addition to that, the governor's office has announced that if there were to be a school outbreak, they would mobilize a mobile testing unit that would be sent to the schools. And that would be after consultation with us. So the testing would be provided free of charge for asymptomatic students or staff who are not known to be a close contact with someone who's tested positive. Anyone under 18 would need permission from their parents. So let's hope we don't have to go there, but we are preparing for worst case, and ensuring that the kids' safety is the number one priority. They did recently, as I mentioned, I talked about the changes that the DESE outlined that are a little bit more consistent with the DPH. So they did make some changes last week, and those changes include definition of close contact, policy of when a contact may return to school, policy of when a student, staff person may return to school, definition of a fever. So just for example, that would be, it used to be 100.4 degrees Fahrenheit, and now they're going down to 100.0 degrees Fahrenheit. One thing I forgot to mention, so students in grade 2 and above are required to wear face coverings while they're in school. They have built-in mask breaks for the students when they need them. The school is anticipating using masks for the K through the 1 as well, which is something they're not required to do, but I'm pleased that they're trying that. They actually had a week-long school for students with behavioral issues a couple weeks ago, and they tried it out on masks with or face coverings with them, and it worked really well. So they were very pleased with those results. They've also, according to DESE guidelines, they have to do a separate waiting area for anybody that becomes symptomatic within the school. So they have already created that, and it looks great. The superintendent also did his own COVID metrics for opening schools. So he pretty much based them similar to what the state's doing. But this also includes the same metrics that the state's using, and then in addition to that, if additional considerations would be needed, they would be talking to the district as well as us. So I'm feeling pretty good about the schools, or I'm feeling really good about what the schools are doing, the relationship that we have. So I'm pleased with that. And then just the last thing, and this is based on the fact that our numbers have gone up a little bit, and Heather will talk more to that, but I am launching a Mask Up Mass, and I'm mimicking the Mask Up Mask initiative that the state's doing, and calling it #Mask Up Acton. So we're going to be taking pictures of town staff with our face coverings on, and we're going to put that out on social media with a little bit of a message from each department underneath. And and we're trying to get out the information. Like, I feel like I've talked to the townspeople so much about wearing face coverings, social distancing, washing your hands, that I feel like now's the time to get a little bit creative. So that's one of the initiatives that we're doing. Um, you know, as I mentioned this before, we're all in this together, and we really want everybody just to do their part and help us to stop the spread of this virus. That's all I have.
Sorry, need to unmute. I think that's great. Charlie, you had actually mentioned, maybe doing a screenshot of all the board members with their masks on. We have 3 of our board members who are not visible at the moment. I don't know. I guess they could send you a shot and you could Photoshop us all together, or.
Yeah, I definitely. I mean, I could have taken a screenshot of our computer, but if that works best, yeah, I'd really appreciate it if you would throw your mask on, snap me a picture, and send it to me. It'd be great to have the board as a united front in this initiative that we're doing.
Okay, I'd be happy to do that. So
thank you.
I don't know about other members, but okay. Well, thank you very much, Charles. Are there questions from members of the board?
Yeah, sure. This is Tom. You planning on taking the temperatures of the kids and teachers every day?
So not me, but it's required of the parents before the students even get on the bus. And then there's protocols for not allowing a child on the bus if they're displaying symptoms. There's protocols if a child starts showing symptoms while they're on the bus. And then there's protocols for when the child arrives at school.
So I think the short answer, Tom, is no, they're not going to be temperature testing on the way into the building. It's up to the parent to do it in the home before the kid leaves. That's what I heard.
Cheryl, I had a question that I thought they were doing a system where some people could choose to be remote if they wish to, or the option of split or a hybrid where they go in certain times and then they're remote the other times.
That's correct.
That's what they're doing. Okay.
Yes.
Other questions? Mr. Cruz?
Yeah. Do they have any protocols on what they plan to do if a kid calls in sick?
So the only protocols that would take effect if someone were to call in sick would be, if that child were to show symptoms, were to be tested, were to test positive, then the protocols are that they go back 2 days and they identify the close contacts of that student. So yeah, there's protocols, but unfortunately, if the child calls in sick, then, and they're also documenting, like they're assigning seating, they're ensuring who was in the classroom that day, so they're taking strict attendance. So if we have to identify any close contacts of that student or even a teacher, for example, all that information is readily available to us.
Yep. Yeah, I know. At work, we do contact tracing, and we're required to do contact logs. But something that we deal with is presumed cases and confirmed. So if someone feels sick, it's presumed if they display some or all of the symptoms, and that kicks off like area cleanings and contact tracing if someone does have symptoms. And just
correct. Yeah, I forgot to mention that. Deep cleaning, yeah.
Yeah, just thinking this might cause a lot of logistical issues for the schools. So, but I'm sure that they have thought about all that.
Yeah, they've put a lot of thought into this. I believe their plans, as good as it can be. They definitely have thought about every possible scenario, and they have each scenario addressed. And if they didn't think of it, DESE did. So, or the DPH. So there's a lot of information out there for them. They're sucking it up like a sponge and ensuring that the kids are safe.
Yeah, thank you, Cheryl. My son is going in, so this is good to hear.
Great. Any other questions from the board? Cheryl, are there any questions from members of the public?
That's a good question. No.
Very good. Well, in that case, next on the agenda is an update from our esteemed director of our town nursing service, Ms. York. Would you be willing to bring us up to speed?
Hi, good evening, everyone. Thank you first of all, to Cheryl and her group for working so closely with the schools and digging into all that information and working with AB School District. As Cheryl said, I think they've done a great job. Everything that I have seen that has been sent, there, like she said, there's such varying information from DESE for quite a while, and I'm glad that they've pulled back their contact tracing information to match what the state is doing. I think that makes it a lot easier for everyone all around, so we're not following all these different guidelines and there's one concrete guideline. So that's really great. Thank you, Cheryl. So as Cheryl said, we are in the green based on the new guidance or guidelines that the state is following to follow the number of cases within town. Cumulative, as of today, we have 198 cases overall. Isolation, as of today, there are 8, and that is why we are in the green area. We did pop up in the last couple of weeks with some new cases coming through. So as Cheryl said, that definitely is concerning. I can say that over the last month, there has been much more travel-related positive cases, not necessarily people that are symptomatic. There have been asymptomatic cases of people getting tested prior to their vacation or even after their vacation to get back in the state with the new travel guidance. So there's definitely been a change with some of the cases that we've been seeing that are positive. What goes along with that are students that are going back to college. They did update today on the MDPH, actually yesterday, I apologize, on our update as public health nursing and following those contacts and positive cases, that students now are considered in the town that they are going to school as opposed to where their parents live. So that is a change. That was definitely something that was discussed early on in the summer with the discussion of schools going back. Initially, anyone within Acton whose primary address is here that was going away to school, if they did come back as a positive case, Acton, Mass would count that case as a positive. That's changed. Now it will be the town that they live at, that they're going to school in, even within Massachusetts. So a UMass Amherst student who is at school becomes positive, whether or not they stay at school to isolate or they come home to isolate, the intent is that they'll go back to school. So Amherst will follow that student. And there is discussion, obviously, there will have to be discussion between the boards of health for the school that is the town where the positive student is and the location where they live. So that's a little bit different. But we have seen definitely a different a change, I guess, overall with some, traveling back to school. And I think, unfortunately, I hope we don't see a lot of that. And I hope the numbers go down. And I think, that the numbers reflect why the governor a couple of weeks ago, pulled back on the reopening plan. It definitely coincides with what we're seeing and what other towns are seeing. I wanted to mention flu clinics. We've had a lot of guidance come out in the last few weeks regarding clinics not having mass clinics within the state of Massachusetts. The recommendation is drive-through clinics, and that is a CDC recommendation also, um, which is what we've been thinking as a Board of Health. A drive-through clinic makes much more sense to us to do. There's logistical pieces that we'd have to work through. We have, a couple of locations we could use, but we'd also have to, and we have been starting to think about how do we do this so that everything is digital. We don't have to touch anything. There's no pens, there's no paper, there's no, shuffling back and forth between a car and the nurses who are giving the vaccine. So those are all things that we're working through, just to throw that out there. I have not received information from our vaccine provider that we're getting or scheduled to receive our vaccine anytime soon, which is concerning. But I think within the next week or two, we typically receive it at the end of August, beginning of September. We get the notification of when it's coming. So I expect that email should come this week, if not next week, so that we can start planning on a date. The date will be determined by the amount of vaccine that we receive and when, because we don't get it all at once. We get it in multiple shipments. And my plan would absolutely be to do a senior clinic, as we do get the vaccine for seniors. And keep that clinic separate from the rest of the population. As I'm sure you all have seen on the news and the guidance that has come through from the Mass Department of Public Health, there is a requirement for all students going back to school, whether they are in hybrid or they're totally remote, that they get a flu vaccine by December 31st, I believe is the date. I don't think I've seen a change to that in the last couple of days. So again, important, as always, to get a flu vaccine, but even more important this year to help reduce the amount of respiratory diseases that are out there as we're dealing with COVID-19, and to help reduce the effects this will have on physicians, and most especially hospitals, to keep those beds and places open for the most acute, whether it be flu or COVID. But flu, hopefully the strains out this year will match the vaccine enough to help to mitigate some of that overriding and that overlap, to not really tax our hospital locations in the state. Other than that, I mean, I think we're pretty status quo. We're doing our contact tracing as we have been since March. The numbers are still on the lower end, even though they've gone up in the last 2 to 3 weeks. We've seen that jump that has put Acton back in the green. As Cheryl said, we're not the gray any longer. Let's hope that we get below that soon again and we stay there for a while. I think that's probably it for me, unless anyone had any questions. Thank you.
Oh, thank you very much, Heather. I have a trivial question, which is, say you're a student, and I'll just pick an example, that goes to school in California, and you come home for spring break. Do you have to quarantine in Massachusetts in your parents' house for 2 weeks?
My understanding would be no. We have had, and not Acton per se, I know of some positive cases outside of the state that their main address is Massachusetts, but they're isolating in the state that they're in.
Okay, more specific, I was just thinking of the governor's travel order where he said if you come from out of state and you don't have test results and it's not from one of the permitted states, you have to quarantine for 2 weeks. But I'm just wondering if that's going to apply, just thinking ahead, like Christmas break or something where.
So I would say that the governor's travel guidelines would be in effect in that matter. If you are in, let's say, Virginia, and you come back to quarantine with your family, you would have to be on that 14-day quarantine unless you left because you were released from isolation. You've already had a positive test result, so you would fall under the guidance that you have to be isolated within your home.
I wasn't thinking necessarily of positive cases. I was thinking of people just coming home for
Oh,
Christmas break.
I think it's if the guidelines are still in place for the travel order, yes, those students will have to be tested before they come back to the state, and have a negative test within 72 hours, or come back, quarantine, be tested, and then if you have a negative, come off of quarantine. I don't foresee that guidance changing anytime soon, especially with how transient we are in the United States. Kids travel, people travel for work. So I think that guidance is going to stay in for quite a while. That'll be on for the long haul, I'm sure, for the winter. I don't know if
Yeah.
Cheryl has any other thoughts.
No, I agree. Their students are not listed as an exemption that I know of. So I agree with everything Heather just said.
Yeah,
Well-
the only exemption is if you are a student that travels, let's say, from Massachusetts. Let's say you live in Massachusetts and you travel to one of the closer New Hampshire. Actually, New Hampshire wouldn't be correct. But if you travel to a school that's close enough that you could turn around and go back within a day, if you could do that, Rhode Island, let's say, because that's one of the high risk states now. If you traveled down to Rhode Island for school, turned around and came back, if you do that on a daily basis, that's one of the exemptions, I believe, is a transit. That makes you more of a transient commuter. And then you don't fall under the governor's guidelines. But anyone coming, obviously, from a high risk state at Christmas break would fall under that guideline.
Okay, what triggered the thought was when you said they moved from counting cases of Acton residents as being an Acton case versus being a case in, say, Blacksburg, Virginia, which is where Virginia Tech is. Made me think, well, if they're changing that, then that means they're no longer a state resident. So consequently, they wouldn't get the state resident exemption from the travel order. I guess we should probably keep an eye on that, but as like Thanksgiving and Christmas approach,
Yeah.
we might want to, I don't know, issue some
I can
informational guidance.
definitely see what you're thinking, but I have a feeling that still won't change, because
Right.
if they're going to school and they're out of state, whether you're out of state for school or work, I think all that matters is you're coming back and you have to be on quarantine.
So then, well, or we should alert parents to say have their kids get tested at the college health service within
Correct.
72 hours before they come back, right?
Correct.
Produce-
Yep,
yeah.
72 hours negative result before you return to Massachusetts. They still have to fill out that form online, regardless of if they're negative. That form still needs to be filled out.
All right. Well, just something for future
Sure.
consideration, and maybe we can do an informational thing for people that are
It's a
concerned.
good idea. Good idea.
Other members of the board, questions for Director York? Well, seeing none, I'll ask Mr. Conaby.
I was waiting for everybody else. Thanks, very much appreciate the update and all your hard work on this. Quick question for you. The schools obviously are a lot on our mind, both the college, which are already going back, but the AB schools, which are going to be coming. You said that you're pleased that they've changed all the guidelines for close contacts. A little concerning that they have the cohort model. So what are your thoughts on that? I mean, because the presumptive thinking of DESI was that the cohorts in the same classroom would be a close contact, but now they would not unless they're within 6 feet for 15 minutes and a positive case. So that's going to be kind of tricky because you're going to have potentially a positive case in that cohort that if they're 6 feet away, they wouldn't be considered. So therefore, they wouldn't know that someone in that classroom, teacher or staff or student, is positive and a potential risk. So they would not quarantine or test.
So I saw the guidance initially from Desi about the cohorts and everyone within the classroom being considered a contact. I have mixed feelings about that because of the way we've been doing the contact tracing. Um, I think it is going to be, on some classroom levels, a little bit of a challenge, especially those within elementary school. But to be a true contact, you have to, like the DPH guidance says, be within 6 feet of that person for greater than 15 minutes to be considered a close contact. So I think unless there is a big, if there's a big concern as potentially this could happen, that a classroom, let's say we have a student A infects student B, C, and D, and then student F also starts to show symptoms, but was not identified as a close contact. Could that change how we look at things? Possibly. I think, as everyone is, we're learning as we go along. I think following the DPH guidance and the CDC guidance that the state of Mass is following is really the way to go and to begin with. But that doesn't mean it's absolutely correct and that it won't change.
It obviously is guidance, but it's obviously being less restrictive and less notification to the potential folks who might be infected. So obviously, in that, there's more of a potential health risk due to that. And obviously, I think there'll be some folks, some of the parents that could be a little concerned in the preschools, the elementary school cohorts, or special education ones where there might be less compliance with some of the guidelines and there might be more contacts. So it's just something that we're going to have to watch. And I anticipate that you may have some parents that will be upset to find out that a teacher or student in their classroom was positive and they weren't notified.
No, I agree with that. I definitely agree with that. I mean, my oldest, who's going to be 30 this year, is a teacher's aide as a one-on-one in a special ed classroom. To say the least, that her students that she's a one-on-one with cannot tolerate a mask is saying that lightly. Am I concerned that she'll get infected? Absolutely. But they're doing everything they can in their school district to protect those workers and those students in that classroom by keeping the numbers down, by keeping the students with the one-on-ones away from each other. So we have to at least try per the guidelines and then revisit it if it needs to.
Yeah, I'm just anticipating we may have some concerns about that, and that
Sure.
folks would want to be able to be tested, particularly if they're going to be around other high-risk individuals. But getting back to the increase in cases that you're seeing in the town recently, is there any trends, age groups? You mentioned more transitory. Any other trends to look at?
Other than the few, back to school that we've seen, or the folks going, for traveling, no, honestly, there's no identifiable trend other than those two that are new. But it's also, we're requiring that new, a lot of states are requiring testing if you're going to their state, because Massachusetts, as an example, is not allowed in Maine without that testing, without at least saying, and they haven't necessarily asked for proof at all times from what I've heard, but they're definitely asking for that, self validation that they've been tested. Although I have heard of some um, toll booths that have stopped Massachusetts residents coming into the state or into the state of New Hampshire, specifically for those checkpoints that are before you get into Maine, that are questioning Massachusetts residents and asking for proof that they've been tested. So I think folks are starting to hear those stories and are getting tested before they go. So I definitely think there's been an increase on that level. And then again, schools down south have already started in the last couple of weeks. So I think that part of that has been what we've seen, because the kids are getting tested before they go off to school.
Are you seeing a lot more tests than we had previously, the number of tests?
So I don't get the number of tests for Acton. That's a new data point that's come out from the state, and I looked at it quickly this afternoon. It seemed like the last maybe 6 weeks, there's really been an increase in the number of Acton residents that are being tested, whether it be for going back to school or traveling. I would guess those are the reasons. Maybe more so than symptoms, because we're not seeing the number of positives to coincide with the number of people being tested. And that's right on the MDPH website. That's a new data point that I think, I don't know if Cheryl can correct me if I'm wrong, I think it came out a couple of weeks ago, maybe 3 weeks ago at most.
Yeah, and the weekly updates that they're doing as well, they're showing the amount of Acton residents tested too. So they do have those data points out there.
Thank you.
The testing results are still coming in fairly rapidly?
From what we have seen, yes. There was a little bit of a lag about 2 to 3 weeks ago, where some folk, actually, it was probably more like 3 to 4 weeks ago, where there was a little bit of a bigger lag time, which I was surprised about, because we hadn't seen that amount of time between testing to results since April or early May. But that seemed to have a little bit of it was a quick spurt of time and then it was over.
Thank you.
Thank you.
Thank you. Other questions from members of the board? Cheryl, any questions from members of the public?
There is not.
All right, well, very good. Well, the next item on the agenda is, are there any required board actions to respond to state changes? I think I know the answer, but.
No, there isn't.
All right, very good. In that case, I believe the next item on the agenda is a hazardous materials control permit.
Yes. Oh boy.
For Fox Pest Control.
Yep. And I do have Ty Hawkins here. I'm going to promote him to so he can speak. Can you talk, Ty?
Hello, how are you guys doing tonight?
All right, sir. Thank you for joining us.
So I'm trying to find his document and give you a little bit of update, but I'm having a hard time getting rid of the one that I already shared. Oh, here we go. All right, so his company is Fox Pest Control. They have insecticides, pesticides, and they have quantities that are definitely over the 25 gallons or pounds. Their quantities are various. Like in some cases, it might be a small amount, and other cases, it might be up to like 64 pounds. So they primarily treat for pests. They also have baits that are considered hazardous. So we've classified them as hazardous materials user and hazardous materials store or small industry. And the conditions that we've picked are on the screen. I don't think Tyler's seen the or Ty's seen these yet, but these are the standard conditions that we issue for these two categories.
Okay, thank you. Not necessary, Mr. Hawkins, but do you have anything you wish to add to Cheryl's description of the agenda item?
No, that was great.
Okay, thank you. Questions from members of the board? Mr. Conaby.
Hi, I guess just a couple quick ones. It says that the pesticide applicator is licensed, so I presume that you have folks that are licensed to handle and apply these materials?
Yes. All of our people that apply materials are licensed and certified by the Department of Agriculture through Massachusetts. It is required that each of us do have a license in order to be able to utilize these products.
Okay, great. And I guess the other two questions are, you have the materials in secondary containment. I didn't see a inspection report.
We store them within a separate storage facility out in the parking lot for some of our products, and the other products we have a specialized area that's locked and has all the necessary signage of being pesticides within that closet, if you will, inside the building.
So some of the materials, the hazardous materials, are stored outside in a locked facility?
Yes.
Okay. I guess I would just make the permit, since you're going to have inside and outside activities, because we'd make it contingent on health department inspection just to make sure we're set on that. And the other concern I have is if you have stuff outside, you have an eye wash and shower, emergency shower inside the building?
There are showers inside the building that we have access to. Yes.
If you have stuff outside, is it possible? I mean, I'm not sure how you're going to handle that, but do you have like a temporary eye wash or something, or I don't know how far it is from the other safety facilities?
Sure. At this point, for the products that we have outside, we do not have something like that. The products that we store outside are granular, so like fertilizer type of material is what that is. So they're in bags, and they are in those bags sealed until the technician takes them into their truck and takes them off site to where he or she uses them on the customer's premises.
Okay. Yeah, you're saying that they're sealed, so that would not be as much of an issue.
Right. Yeah. Sealed bags. Yes.
Okay. I guess I'll leave that up to the field inspection.
Yeah,
All right,
we'll
you.
make sure that that's all set at the inspection mark.
Other questions from members of the board? Questions from members of the public?
Sorry, I do not see any.
Very good. Is the board comfortable with making a motion on this agenda item?
I move we approve the permit.
Thank you, Ms.
But it
Vicetta.
does not.
Thank you. Is there a second?
Second.
I will second it.
Okay, very good. I think I was going to say, actually, I think Mark beat you by about a half a second.
Okay, Mike can beat. I thought Mike did, but that's fine.
Okay. Well, it just depends on your internet connection, I guess. Dr. Bill's back. I think you dropped off there for a little minute. Maybe not.
No, that was just the unmute.
Got it.
For the vote. Yeah.
Very good. All right. In that case, all those in favor, and I'll start with you, Dr. Bill. Please say aye.
Aye.
Very good. Mr. Cruz.
Aye.
Mr. Conaby.
Aye.
Vicetta.
Aye.
And I am also aye, so motion passes unanimously. Thank you very much. Thank you for your time, Mr. Hawkins. you should be all set. At least your interaction will be with the health department going forward, but we're all set with tonight's agenda.
Okay, great. Thank you very much.
Thank you. Thank you for your time. I apologize, Cheryl. I cannot remember exactly what's next. Is it the North Acton Fire Station?
The next thing on the agenda would be the Acton Fire Station aquifer special permit.
Very good. Is anyone intending to present that?
I do have a few people, I think. Let me, so I think I'm just going to pull up the conditions that we know. Actually, no, I think they have a PowerPoint they want to go over. Let me just pull that up, and then I'll grab them.
Okay. Did
So
you
can
want
you see
to?
you can see the PowerPoint?
Indeed. Did you want to introduce the topic? Is there anything just a background for us, or?
Yeah. So this is a new fire station. They, are in Zone 3. They're looking for an aquifer special permit from the board. The septic system's been reviewed, and this is one of the final things that we're waiting on for approval. So they are, I'll let them talk to, the distance from the wetlands, and they are over 100 feet from the wetlands. Nitrogen reduction is not required. It's just because it's in a Zone 3, but let me pull up the people. So I think David Baptiste, who else? Oh, Kevin, right? Can you talk?
Yep. This is
All
Kevin.
Very good.
All
Good
right.
evening, Mr. Sanders.
Good evening to you.
Anybody else, Kevin, besides?
Danelle Baptiste will be on the line if he's a septic system designer, if there's any specific questions to the septic system. And we also have project manager Kevin Wetzel from Castle Boost, which is the architect's project manager, if there's any architectural questions.
Okay, so I've allowed them all to talk. All they have to do is unmute themselves. So if you want to go ahead, Kevin, and talk a little bit more about this.
All right, so if you just want to go to the next slide.
Trying.
So for people who don't know where the site is, it's on the north side of Harris Street before you get to Route 27 in town, in the north side of town. If you want to go to the next slide, we'll go through these kind of quickly. I just want to give you a quick overview of the project if you guys haven't seen it before. This is the existing site right now. It's a building with some storage sheds that we're going to be converting into the fire station. The next slide, please. This is the existing conditions showing the wetland and the wetland buffers on site. And you can see that the existing building is in the buffer and we'll show you in the next slide what we have for proposed conditions. So you can see in the proposed conditions, we have a new fire station and a small building out back. The septic system is in the green area in front near Harris Street. So it's outside the 100-foot buffer. And we have some stormwater in back and some infiltration units and the typical utilities for the fire station. Next slide. This slide pretty much shows you where the septic system is in front in the green area in front of the fire station. Again, it's outside the 100-foot buffers. So we would be outside any resource areas. Next slide, please. This shows how far we are going to be from the Zone 1. We're about 0.8 miles away from the Zone 1 protection zone. If you want to go to the next map, we can look at the Zone 2. In the Zone 2, we're just about 0.4 of a mile away from, 0.4 miles, sorry, from the site for the Zone 2. So we just wanted to give you a quick overview of the project and see if you guys had any questions. I know we had some preliminary pretty much conditions, and Cheryl and I worked through those this afternoon. And we just had one issue with one of the conditions about floor drains. And Cheryl, should I talk a little bit about that to give them a heads up, or would you like to do that?
Yeah, they haven't seen that yet, so let me pull that up for them. I'm just not that good with screen sharing, sorry. So these are some conditions that we worked up this afternoon in the hopes that we can make this process go a little bit smoother. So, you know, these are all fairly standard conditions. So we have, you can see the conditions that we have here, but basically we're just trying to protect, you know, the aquifer, so we don't have any problems. So we have that the septic system should be approved by the health department. Construction activities, including earth removal, storage, and fill, shall be approved by the health department. A plan documenting the proposed site activity, including soil erosion and runoff containment requirements to preserve groundwater recharge, limits on the extent of impervious cover, and treatment of water runoff. And I have that approved by both us and the engineering department as they do some of that as well. Any subsurface wells, including geothermal and irrigation, shall be designed in compliance with all state and local regs. No underground fuel storage tanks. The septic tank shall be pumped a minimum once every year or as determined by us. And compliance with the Town of Acton Hazardous Material Control Bylaw, and floor cleaning procedures for the building shall use only non-toxic and biodegradable cleaning compounds. Sewage disposal system shall be 100 feet from any floodplain or wetlands. And I think I'm showing the wrong copy. We amended the number 13 there. Let me see if I can pull up the right one. And basically, just want to make sure I got the right one here. So floor drains are not permitted except floor drains which are connected to a tight tank with monitoring system and maintenance plan as approved with conditions by the health division. And I think Kevin and I had discussions about that earlier. And I think you guys are okay with that and all these conditions as proposed, correct?
Yeah, and we just wanted the original conditions had that there was no floor drains allowed. If we do have a couple floor drains in the bays for the fire trucks for excess water, if they were kept coming off the fire trucks and catch it, and it goes into a tight tank that's going to be pumped out when they needed to pump it out. And it's a 5,000 gallon tank, so it should hold a fair bit of.
Right, so we have no concerns with that as long as it's being discharged to that tight tank.
Okay, thank you very much. This time, just ask other questions from members of the board. Mr. Conaby.
Yes. Yeah, these conditions look great. I just had one question about the floor drains. You said that they're in the bays for the fire equipment, is that correct?
Yes, yep. They're in the truck bays.
So that they're interior ones.
Correct.
And are the entrances bermed so you don't wind up getting a lot of rainwater and other things coming in?
The grade pitches away from the doors in those areas, so we wouldn't have anything coming through, pass through.
Okay. I would ask also, if my memory serves me right, there are decontamination showers inside the facility, is that correct?
I would, Kevin Wetzel's on the phone. He's the architect's project manager. He can probably speak to that better.
Yes, this is Kevin Witzel with Castle Blues. Yes, there is a decontamination shower in the immediate area to the apparatus bay, and those flow drains themselves do go into the tight tank as well. Right. So everything that's associated with the fire kind of tech terminology we tend to use sometimes is called firematic operations. It goes into the drains that go to the tight tank.
All right, so they're not connected to the septic system.
Correct.
Okay, so that would be the emergency shower. Are there any other floor drains in any of the other mechanical rooms or other storage areas?
I don't know off the top of my head. The mechanical room is on the second floor, and I don't believe that I honestly don't know if there's a floor drain there. I'm gonna try and see if I can pull up on my computer what the.
I guess the concern is that the sanitary and the domestic and the regular personal showers and things could be connected to septic, but all of the other drains or fixtures would be connected to the tight tank just to make sure that it wouldn't be discharged to the ground.
Yep.
Okay, I think that's the intent of the regulations. I just want to clarify that that's what's expected and just make sure that's what's being designed and implemented.
Yep. I just trying to check them, pull up a drawing to see if it's, so I can confirm that. That is, I believe that is correct.
Are you still checking, Mr. Witzel, or?
I believe that it is that it all the firematic stuff goes to the tight tank and all the non-firematic stuff goes to the sanitary.
Okay. Well, my suggestion would be, since you that's your intention, but it just needs to be verified, I would suggest that that be a condition, and then it should be easily satisfied.
Yeah. So basically, all non-sanitary waste shall be directed to the tight tank. Very simple.
And you can verify it, or you can make it so.
I think it's easier just to put it in that way. It was a question about the floor drains. They're prohibited in the regulations in general, but obviously this is a good situation where it needs to be done. I guess, do you expect a lot of fill or other removable materials for the project?
I don't think we're bringing too much fill in. Just let me double check that.
Obviously, you just want to make sure it gets tested. I mean, there's been concerns at one of the other sites in town. There's arsenic and other contaminants, so I just want to make sure that that would be part of the plan that would be reviewed by the health department to make sure that that doesn't happen.
Yeah, it looks like we're potentially raising the grade about 6 inches to a foot across the site from the spot checks that I'm doing.
So it'll be quite a bit of fill then, truckloads. Obviously, there will be a hazardous material bylaw permit. I don't know if the town's exempt from it, but I would certainly hope that they would, since they're the ones that are also helping with it, provide the plan and the accommodations, work with the department to make sure that's implemented.
Yeah, I believe the town has gotten permits previously, so I don't believe they claim an exemption.
Yeah, for town offices, we require the permit if they're storing 25 gallons or pounds, and we just waive the fee. We don't charge a fee to ourselves.
Sounds good. Last question, is there geothermal wells on the project?
There is.
Yes, there is.
Yeah, they go along the side driveway and up around near the existing building to remain out back.
Are they going to be bedrock wells? Or don't?
Can
I don't know if I believe they are. That's the best way to get from what I understand, the way the systems work, that's the best way to get the uniform temperature of the groundwater.
Are they gonna use water, or are they gonna use like a refrigerant, like a glycol?
It'll be it's a closed loop system, so it will be glycol in the lines. It doesn't it just completely recirculates, and it's a closed circuit. We're not taking in any extra water or discharging the water. It just recycles throughout the system.
Okay, just want to make sure we use a non-toxic glycol solution or other approved methods. And of course, that's a condition for the health division will approve, but just want to be clear on that.
Yep.
All right, thank you.
Thank you, Mark. Other questions from members of the board? Mr. Cruz.
Yes, I've got one question. Is like I guess the septic system looks like it's pretty close to the street. Is that coming to the board as well soon? Or is that conforming?
I'm not aware that they need any variances for that, Mike.
Okay. The other question is I'm not familiar with tight tanks. What happens if you get to the capacity? Does it just like, I would assume stuff stops going in and it spills out? Is that correct?
Well, it's got set up that there's monitoring floats in the tank itself. So as it starts to fill, it gets to a certain point, it'll set off an alarm inside the department, inside the building, to alert them that they have X amount of, I forget what the capacity is that it goes off at, so that they have time to call Clean Harbors or some other hazardous materials hauler to come and pump the tank clear. We initially started off with a 2,500 gallon tank, and then I believe the chief talked to some other chief in the neighboring town and said that you want to probably go to a 5,000 because you end up calling Clean Harbors way too frequently with the 2,500 gallon. So we upgraded it to a 5,000 gallon to give them a little bit more storage capacity.
Okay, thanks. You just answered my next question: is how do you size it? So I guess it sounds like it's based on an actual use. So that's good. That's all the questions I have, Bill.
Thank you, Mike. Other members? Questions? All right, seeing none. Cheryl, any comments or questions from members of the public?
I do. I have two. I will allow Kim Castens to talk first. You need to state your name and your address, please.
And unmute your mic.
My name is Kim Castens. I live at 294 Pope Road in Acton. And I'm just noticing condition number 5 says a plan documenting that the proposed site activities will not degrade the groundwater. And I'm just encouraging you to pay particular attention to the implementation of that condition, and that the plan, so a plan needs to be produced, but that you put in place a careful set of checks and balances on what that plan says. And the reason that I'm particularly picking up on that is because we're now coping with PFAS in our drinking water, and one of the sources of PFAS historically has been not necessarily in Acton, but in some communities has been firefighting children. So the expertise to recognize what might be a danger in a fire station and fire station site activities, differ from the vast majority of buildings and building projects that you guys would be called upon to pay attention to. So I just wanted to, say that having them submit a plan isn't important. There needs to be some sort of special expertise potentially brought to bear on what those sufficient. And I also wondered, the Acton Water District get called upon to comment on situations like this. And that's all. Thank you.
All right, thank you, Ms. Castens. I can answer your last question. Well, I can sort of address your both, although Cheryl may be able to add something. So certainly the plan does look at proposed site activities. We do look at what's stored and used on the site that are known, human hazards. And then we try to make sure that there's at least, I'll say, 2 levels of safety in terms of having them released to the environment. their normal storage and then a backup containment. And that would be typically addressed during the hazardous material control process that Cheryl mentioned previously. This is a permit to be able to perform work, particularly install a septic system in a aquifer recharge area. It's a zone 3 out of 4. So this is the first level of concern. Zone 4 is no concern. Zone 3 is, some concern. Zone 1 is where the well is located. So obviously that's the most concern. So this one, like I say, is mostly addressing risks to groundwater in particular. And so that's why, like you heard Mr. Conaby focus on things that could potentially, make their way into the groundwater. For the hazardous material control process, that would focus more on what hazardous materials are stored on site and used on site and how they're contained. And then the last part for the Acton Water District, typically no, they helped promulgate the regulations, but they leave the enforcement to this board. Cheryl, did you want to add anything to that? You have to unmute, Cheryl.
Yep, you did a good job, Bill.
All right, I get a cookie.
Yeah.
Thank you. All right.
We do have one more person. It's only a phone number, so I'm going to have my hand quickly on things. So phone number 617-875-7124. I'm going to allow you to talk. Please state your name and address. Go ahead. You need to unmute. Oh, all right. You can hear me?
Yes, we can hear you.
Yep. Yeah, my name is Danelle Baptiste from Samiotis. I'm just here in the background. I'm with Kevin, the two Kevins.
Okay, very good. Thank you. All right, well, in that case, I think we've had a full discussion. Is the board ready to disposition this item? Does anyone care to wish to make a motion?
Bill, I'll make the motion to approve the motion with conditions as noted.
Very good. Thank you, Mr. Cruz. Is there a second? Mr. Conaby?
I would second it, but I guess we just had that one correction regarding the floor drain. So I guess I would second it with that condition if Mike, as amended, if Mike's acceptable to that.
Yeah, it was my intent with the revised amendment. Yep.
All right, thank you.
Very good. We have a motion made and seconded. Is there further discussion from members of the board? Hearing none, in that case, we will vote. We'll go the opposite direction on the list this time. Ms. Becerra.
Aye.
Mr. Conaby.
Aye.
Mr. Cruz.
Aye.
Dr. Taylor. And I also vote aye, so motion carries unanimously. Thank you very much. Thank you to all the people that participated. We very much appreciated your input and comments. And hopefully we will have a successful project.
Thank you.
Thank you.
Okay. So the next item on the agenda is 110 through 112 Central Street. I thought the engineer was going to be here. I don't see his name on the list, but I can talk to this.
It's definitely your best picture yet, Cheryl. The one that just came up.
Oh, yeah?
Oh, that's a very nice,
It changes. So actually, let me get our letter. Hold on. All right. So this is a repair of a septic system. It's a tight lot. They're looking for a lot of variances. Reduction from 10 feet from the septic tank to the front property line. Reduction from 10 feet from the pump chamber to the property line. Reduction of from 75 feet from the wetlands to 50.2 inches setback, which is in compliance with Title V, just not our regulation. And they are putting in a singular system to help with nitrogen reduction. And then the last one is the overdig around the septic system, reduction to the wetlands, and that's about 30 feet. So we are recommending that these be approved. We want the conditions, you know, we can add a condition here that should be here that we would like, they need CONSCOM approval as well prior to installation. So I've already had a chat with the conservation administrator, and he's fine with it as long as the board is.
Okay, very good. Thank you, Cheryl. So is there, you can't tell if there's anyone here to speak to this from the petitioners?
Not from the names. I don't know if anybody's here to speak to this, you can raise your hand. I did have a chat with the engineer this morning, and I don't know, maybe it's his phone number here. Let me give it a try. Is this Russ? Russ, you need to unmute yourself. Is that you?
Yeah, here I am.
Okay.
Oh, hello?
Hi.
Hello.
Yeah, it's Russ.
Very good. So I don't know if you heard Cheryl's introduction of your.
Yes, I did.
Okay. This looks like it looks like it's a very tight lot, and you need a lot of help from the board. Just my question is as always, is this the best that can be done, or is there, you know, any alternatives where you could get closer to a compliant system?
No, the way it is closed in there. There's not only is the street close to the house, and the house close to the wetlands. Also, there's we dug holes, and there's anywhere from 2 feet in some places to 10 feet in some places of fill. And so a lot of that material is going to have to come out and be replaced. So, but I thought that was the best place you could possibly put that septic system. So there it is.
Okay, thank you. Questions for members of the board, for the engineer or the health director? Mr. Conaby.
Yeah, seems like my night. My concern is you've got the tank and pump chamber, you know, 2 feet from the edge of the street. And looking at the plan, it looks like it could be moved back, but my question is, why wasn't it moved back? And I understand maybe 10 feet is difficult, but typically we only don't allow anything less than 5 feet. Could it be moved 5 feet away from the edge of the roadway?
Yes, we could do that.
Okay.
We were just trying to keep it 10 feet, and but
10 feet from
if
where?
we want to split the difference between the house and the street, that's fine with me. We just have to rearrange those walkways.
What is the elevation between the living space in the properties and the elevation of the septic tank? I didn't see it on the plan.
The top of the foundation, I believe, is 200.
Yeah.
And it was, I think it was, it's pretty tight between the existing tank and the outlet, and we're proposing to put the elevation of the tanks as the same as they are now.
Yeah, I guess what I'm trying to figure out is the septic's, is there a basement where you have potential for the wastewater flowing from the tank into the basement of the property?
Well, yeah, there is a full basement in that house.
So
that's why, you know, one of the reasons why we want to keep that tank 10 feet from the house.
But I think Mr. Conaby is referring to, and also you might want to make it deeper than the basement, right? So that, you know, there's no ability for the water to flow into the basement.
You're pumping out anyways.
Yeah.
I don't quite understand the question.
Bill, go ahead. I think you understand.
Okay.
I'll let you
So,
go.
all right. Well, so he's suggesting that the tank be below the elevation of the basement so that should the tank develop a leak or otherwise have an issue that there's no flow into the house.
I gotcha.
It's-
Yeah, well, the only way we do that would be, it's a full cellar, so, you're talking, the grade from, at the house to the cellar is 7 feet, so the tank would have to be at least, 10 feet deep. Which
Right.
is not a good idea for a septic tank. It'd be pretty hard to access for one thing.
Yeah. So so
only-
you're saying it's a finished basement, but there's no plumbing in the basement. The elevation of the piping is coming out just below in the ceiling of the basement. Is that correct?
Yeah, it's about a foot down from the existing grade at the house.
Yeah. All right. So the best you probably can do is to move it 5 feet from the roadway, and then you probably have to make it as
Yeah,
low
it's
as you
pretty,
can in elevation and put a poly barrier between the house and the tanks.
yes, I would say so.
I think that would be a more reasonable variance. Central Street's pretty busy and it's very close with heavy traffic and everything else. So I think the integrity of the system, maybe being 5 feet from the roadway, which is a normal variance, and then put the barrier in and try to reduce the depth of the tank as much as feasible since you're pumping it. But I guess that's to the health department.
Yeah, I think the edge of the pavement is a good 10 feet from the edge of the right of way. So the tank's not going to be 2 feet off the pavement. It's going to be 2 feet off the right of way.
Okay. I guess I'll leave that to the town to decide because of the right of way what they think will be an appropriate situation.
But the answer to your question, yes, we could move that tank. We could split the difference between the street line and the house if the board would prefer something like that.
I wasn't. Go ahead.
Okay, maybe I'm not seeing the plan a little. Oh, I see. Okay, now I get it. I was going to say I didn't think the tank would necessarily get closer to the house, but I see it would.
Correct.
In one corner. Yeah.
What is the right of way in this area, Russ? Is it 5 feet or?
You mean the distance from the right of way to the edge of the pavement?
Yeah, so if you took the edge of the pump chamber, which you're showing as 2 feet, that's 2 feet to the right of way, not 2 feet to the road, right?
Correct.
And how much distance is from the right of way to the road?
I believe it's 10 feet and a sidewalk in between.
So
you got
in
the
a
edge of-
sense, you're 12 feet from the road.
Yes.
We can work with him on this if you'd like.
Yeah, it sounds a little more complicated. At first, I thought it was 2 feet from the road, which was the way it was described, and that was kind of tight. But if the right of way has the sidewalk and everything else, keeping it 10 feet from the basement where it's going to be above the habitable space is a prudent measure. I would suggest either case, maybe we put in a poly barrier if that's acceptable.
Yeah, we could do that.
Yeah. All right, so I guess work with the health department to determine how much of a variance you need on that, but in either case, it would have to be staked and marked by a licensed surveyor just because it is with it that close to the right of way.
That's not a problem. We got we're pretty well walked into where the street line is, so I would prefer to keep it the way it is, but if you feel better about just moving toward the house and putting in a poly barrier, that's not a huge difference either. So
I think my suggestion is work with the department, determine what's best based on the right of way and distances, but put a poly barrier in since it is close.
Yeah, I think ultimately what Mark's suggesting and what I'd agree with is if, you know, as you say, you're at least 12 feet from edge of the pavement, that's probably a reasonable location. Keeping it away from the house is probably good, but a poly barrier is still, I would say, required to get the distance to the house and to the road. Because
Okay, now,
that's just to prevent, you know, infiltration into the basement.
okay.
Yeah. Can
Well,
I,
there's been a septic tank there. We're putting our septic tanks for 50 years. So if I put tanks in the same place, I would think we're not going to have a problem with infiltration into the cellar.
It could be you've had 50 years of good luck, but
okay.
I mean, it seems like a reasonable, I'll call it compromise, but it provides, you know, some certainty, and our goal is to prevent people from, you know, winding up in unhealthy situations. So,
yep. Okay, no, I don't have a problem putting a poly barrier there.
Okay, Mr. Cruz, I think you had a comment.
Yeah. So do we have minimum setbacks from the house? Is that 10 feet for the
to the tank? Yes.
Tank to the house is 10 feet, and where they are right now, is that 10 feet away?
Yes.
Okay. I would just, you know, there was a suggestion about moving these tanks closer to the house, but you know, I think it's probably more important to maintain the 10-foot separation to the house rather than getting it further away from the pavement and right of way. That's just my thinking.
Well, I think actually Mark and I were both agreeing with you, Mike, that that's maintaining that separation as long as we still have, you know, reasonable distance to edge of pavement is a good idea.
Yeah, it's just so if we are maintaining the 10-foot separation, why poly barrier?
Because of the height of the tank. Because right now the tank is higher than the basement. So
yeah, I guess the question: do we require that of other septic plans?
Typically, yes. No. Well, I would say yes, based on my experience for variances.
Well, I guess, yeah, Cheryl, if someone came to you, like if this came to you, there was no street here, and it was, would you approve it without the poly barrier?
I mean, based on the grade, I would say it's a good idea to put the poly barrier in. And it's a really minimal cost. I don't know if Russ knows what that cost is, but it's not much. It's just added protection, Mike, that should be warranted.
Okay.
Yeah, well, my thought on that is if you're going to put a poly barrier in, you're going to have to dig a ditch right at the face of the foundation. And you'll never get compaction like it is now. So when you backfill it, you know, the water's going to find its way to the foundation. So I think you're better off leaving it the way it is. Myself, that's just my opinion.
Okay, well, thank you. I mean, you have the opportunity, and I'm not the installing expert. You are. But it would seem like you could put the poly barrier. I've seen it not placed directly against the foundation. So don't know if there's opportunities there.
Well, yeah, I know that, but you're still going to have to dig some kind of a trench to get the poly barrier into the ground.
Well, I'm suggesting, and again, this is not my business, so I don't do this on a daily basis. But I'm suggesting you're going to have to make an excavation for the tank anyway, and you know, incorporate the poly barrier into that.
Okay. I'll talk to Evan and anybody else concerned about that and come up with a solution that should make everybody happy.
Okay, thank you.
But are you still suggesting to move the tank closer to the house?
No.
Okay. Okay, then we'll make it work.
Okay. Other questions from members of the board? Questions or comments from members of the public?
Looking, sorry.
No worries.
No, I don't have any.
All right. Members, are we inclined to either allow or deny this request with the conditions as noted?
So moved.
Very good. I take it that you are moving to allow it.
Indeed.
Thank you, Ms. Becerra. Is there a second?
Yeah, I'll second it.
Thank you, Dr. Taylor. We have a motion made and seconded for approval with conditions as noted, and we'll go top down in this case. So Dr. Taylor, you're first, or how do you vote?
I'll vote aye.
Thank you, Dr. Taylor. Mr. Cruz?
Aye.
Mr. Conaby?
Aye.
Ms. Becerra?
Aye.
And I also vote aye. Motion passes unanimously. Thank you very much, all. Thank you for your consideration. Sorry, I don't know your last name, but Russ, thank you for your time.
Yeah, it's Russ Wilson, and I appreciate all your help.
Well, you've got a difficult situation. We recognize that. So hopefully we've got the best possible outcome.
Yeah, it's one of the tougher ones I've ever done. So,
Hey, Bill, is this one of these properties that should have been on sewer if one of the expansion projects got approved?
So I was just looking at its location.
No,
Okay.
no.
So this,
It's on the other side of the tracks, down Central Street towards the train station.
okay, yeah, I thought this might have been covered under the Spencer Tuttle Flint, but yeah, I'm just surprised that this one wasn't identified as a high need lot.
I'm sure it was, but I think it would, well, I think if the district got expanded to include Dover Heights, which I think is pretty much across the street, this would have been included.
But it was on the wrong side of the tracks.
Yeah.
Okay. Yeah, or in other words, it was, the costs start increasing exponentially as we have to navigate around some things like railroad tracks and ledge and all the other things that are around, because we don't have a local solution for sewage in West Acton. All right, well, Cheryl, what's next on the agenda? I believe it might be minutes.
Minutes.
okay, well,
Very
thank
good.
you very much.
All right, bye, Russ.
Thank you, Mr.
Bye.
Wilson. So I believe the first set of minutes in July. I don't remember exactly which date, but it's
July 29th. Can you see my screen?
yes. Thank you.
Okay. Yeah.
This was a set of minutes that the board had noted didn't, I'll say perfectly or with great didn't represent the activities of that night in the fashion that we'd hoped to have it captured. So went back and re-examined it, and I believe the department has recast them to be a little more in line with what the board's wishes were.
That's correct. I went back and listened to the tape, and we made changes that are reflected in this set of minutes right here. I have conditions 4 and 5.
Very good. So I've read them. I read them previously, and like Cheryl says, the issue had to do with the exact wording of conditions 4 and 5. So I have no comments. Members of the board, comments or questions on the minutes?
I had one question on the roll call, Cheryl. Was I offline for voting?
So when I listened back to the tape, it was a little unclear. So I did, that was you that I put in this note here, the internet issues caused a member to drop. I did not hear you vote aye, Mike.
Okay.
Yeah.
Sorry, I remember if I had a vote, it would have been against it. Was this the one where they were putting the tanks on the other side of the building?
No, we already did the tanks. This was, you had voted no for that one. This was for the septic, the leaching field.
No, there have been so many of these, it's hard to
Yeah.
keep them straight.
I would agree with you.
Okay.
So this was a meeting actually very unusual. Dr. Jacoby was voting for an absent Ms. Becerra, I believe. I don't remember exactly which member, but and then Dr. Singh was not voting, except when we went to vote. Mike, you had dropped off the Zoom roster, and since Dr. Singh had participated through the entire discussion, deliberation, and is a voting associate, I called on her to vote in your stead since you were absent.
Yeah, okay, it's coming back to me. Yes, I had internet issues, and yeah, I think this was when I was off. So yeah, that makes sense. So
Yeah, not only
Cheryl,
it was
Cheryl, excellent work on these revised minutes.
Thank you.
Okay, well, should I interpret that as a motion, Mr. Cruz?
If there are no more comments, then yes.
Very good. We have a motion to accept the minutes as written and as revised. Is there a second?
I'll second it.
Thank you, Dr. Taylor. We have a motion made and seconded to accept the revised minutes of July 29. All those in favor, please say aye. I'll be starting from the bottom. Ms. Becerra.
I'm going to abstain since I wasn't at the meeting.
That's a very good point. Fair enough. Mr. Conaby.
Aye.
Mr. Cruz.
Aye.
And Dr. Taylor.
Aye.
And I also vote aye, so motion carries. Thank you. Next is our meeting minutes of August 5th. I did get an opportunity to read these. I have no comments. Ask if there are other comments from members of the board. Hearing none, are we of the mind to approve these minutes?
I made
So
the last motion. I'll second.
Thank you, Ms. Very good. Thank you, Ms. Becerra and Mr. Cruz. We have a motion made and seconded. I'll ask if there's no other comments. We'll please vote. And going in opposite direction, Dr. Taylor.
I'll vote aye.
Very good. Mr. Cruz.
Aye.
Mr. Conaby.
Aye.
Ms. Becerra.
Aye.
I also vote aye. Motion carries unanimously. Thank you very much. I believe that actually brings us to the end of our business for tonight. I had one administrative thing I'd just like the board's opinion on. I struggle when we get the DocuShare link and it has 12 documents on it. And I try to read them online, but it's difficult to compare things from, like, look at the drawing or the map and then read the words at the same time. And I kind of miss the good old days of getting a packet in the mail. So, but if I'm the only person that has that handicap, I will certainly struggle through with the DocuShare. But if other members also would like to get the packet in the mail, I would be interested to know that. How do members feel? Ms. Becerra, you're actually unmuted, so.
I am. I'm happy looking at it on the computer.
Okay. Fair enough. Anyone else?
Yeah, I think the digital is a greener approach.
I agree it's greener.
Unless
of course you use a lot more electricity. I don't know.
Well, I do remember the town manager complaining that we were using too much paper. Board of Health.
It's more it's more recycling to help. Anyway, okay. All right. Well, it seems that people are pretty happy with the digital version, and I'll muddle through. I can do this.
You know, Bill, I will say one nice thing about the mail is it's kind of like a reminder that, we have a meeting, but, do we need a huge stack of paper for that? I don't know. I actually kind of like the, DocuShare in that regard.
Okay. Well, very good.
Also, Bill, should you so desire, you can print it out at home.
I can if I had. It's a lot of pages, and I'm not well facilitated for volume printing, but
If it would be helpful, when I go in and I do the documents, I can code them, right? So I can correlate them with the item number on the agenda and then do A, B, C. And so I can name the documents so you can see the group together. If that would be helpful for you, I could try something like that.
that sounds like that would be helpful.
Okay.
So,
Problem I have when there's maps, they're kind of small and hard to see.
well, there would be an argument actually for your electronic where you can blow it up, right? I guess.
Yeah, you can zoom into 300% into
Right,
detail.
That was my point.
Okay. All right. Well, thank you. That's fine. I mean, no problem. I just figured I would see how people felt, and I understand. So that sounds like we'll just move forward. So thank you. So again, I believe that brings us to the end of tonight's agenda, unless there are other issues or comments that members wish to bring up or the director wishes to inform the board about.
I just have the one thing, as Bill mentioned at the beginning of the meeting, if you guys can throw your masks on and snap a picture, I'd really appreciate it.
Okay. We'll send it to you. Hopefully it won't break your computer.
We haven't broke Zoom, so I think we're doing all right.
All right. Well, Dr. Taylor, this would be the time for you to make your favorite motion.
Yes, I make a motion that we adjourn.
Is there a second?
I will second.
Very good, Mr. Cruz. I saw everyone's mic unmute at the same time, so I have a feeling I know which way this vote will go, so we'll take it by voice vote. All those in favor of adjourn, please say aye.
Aye.
Any opposed? Okay, we stand adjourned. Thank you very much. Very good meeting.